working as assistant professor in Dr. MGI Educational Research Institute, Faculty of Physiotherapy. Today we are going to learn about goniometer. So goniometer, this is used to measure the range of movement of your joints. So the use of this goniometer is that you can evaluate the patient, and also you can change the treatment protocols according to the range of movement. If the range of movement has been improved little more, say a 2 degree or 3 degrees, we can change your treatment, or you can show some prognosis in your treatment. Now we are going to measure the shoulder movements with the digital goniometer. This is a digital goniometer. This is on and off. This is hold. If you want to hold while measuring the range of movement, you can hold this. And this is a degree, displays a degree button with measurement inches. If you want to have degrees and also the inches, it will display. For example, this is the on. If you want to off, means long press. So now we are switching on. So now we are going to measure shoulder movements, shoulder flexion. So patient position is lying position. So therapist position, we have to stand by the side of the patient. Now fulcrum is placed, you palpate the head of the humerus, place the fulcrum point. This is the movable arm and this is the immovable arm. Now we'll instruct the patient or the model to bring the arm backwards. Okay, bring your arm backwards. So now the degree is 179.5, that is 180 degree. So shoulder flexion 180 degree. So now we are going to measure about the shoulder extension. For this shoulder extension, the patient position is prone lying with the head turned to one side, and this goniometer you have to place the point, that is the fulcrum is over, we have to palpate the head of the humerus and place it. The movable arm is parallel to this humerus and this immovable arm is parallel to the couch. Now we have to instruct the patient or subject to bring his or to lift his arm upwards. Okay, relax. So the degree we got is 45 degree. So the normal range of movement is 45 degree for shoulder extension. Now we are going to measure about the shoulder abduction. So for shoulder abduction, the fulcrum, that is the fixed axis, is about the, we have to palpate the head of the humerus, and then the movable arm is parallel to this humerus, and this immovable arm, this is placed with the imaginary line joining this humerus and sternal notch. While measuring this shoulder abduction, this 0 to 100 degree is measured with the shoulder internal rotation, and after that you have to externally rotate your shoulder and then measure from 100 to 180 degree. First we will see the shoulder abduction with the shoulder internal rotation. Just bring your arms outwards. This is with internal rotation, and afterwards ask the patient to do the shoulder external rotation. Instruct the patient to move your palm upwards, and now move your arm. Okay, so now we are going to measure about the shoulder adduction. For this, the patient position is supine lying with his arm abducted, completely abducted. So you have to place, the fixed arm is placed over the head of the humerus, and this movable arm is placed along the axis of the humerus, and the fixed arm is placed just parallel to the trunk. Now we are going to measure about the shoulder adduction, in which the fixed arm is over the head of the humerus, and this fixed movable arm is parallel to the trunk, and movable arm is over the just parallel to the axis of the humerus. Next, we have to ask the patient to bring down his arm downwards. Yes. Now we are going to measure about the shoulder external rotation and internal rotation. For this shoulder external rotation, patient position is supine lying, and therapist position is you have to stand by the side of the shoulder where you are going to do the measurement. and you have to place your shoulder abducted to 90 degree and elbow flexed to 90 degree. In this is the olecranon process. Fulcrum is the olecranon process, and this movable arm is along the long axis of the ulna, and this fixed arm is just perpendicular to the ground. Now ask the patient to move his forearm backwards for external rotation. Okay. So for the external rotation, the degree is 0 to 90 degree. We are going to measure about the shoulder internal rotation. For shoulder internal rotation, patient position is supine lying and therapist position is stand by the side of the side where you are going to do your measurement. And for this you have to do a shoulder abduction. You take care that such that the pillow or there is no restriction, and elbow is also flexed to 90 degree. Your fulcrum, that is axis, is olecranon process, and movable arm is parallel to the long axis of the ulna, and your movable arm is just perpendicular to this ground. Now you have to instruct your patient or subject or model to face the palm downwards. Now bring your palm downwards. Okay. 0 to 80 degree is the internal rotation. Now we are going to measure about the elbow range of movement. So for elbow flexion, the patient position is supine lying. This fulcrum is the lateral epicondyle. This is a fixed arm. This is a movable arm which is parallel to the long axis of the radius, and this is fixed arm or immovable arm parallel to the axis of your shoulder. Then take care that the patient or the model should not lift his arm out of the couch, above the couch. Now instruct the subject or model to bend his elbow. Bend his elbow. Bend your elbow. Now we are going to measure elbow extension. For elbow extension, position of the patient is a supine lying, and you have to bend your elbow completely to measure the extension. Now the point is fulcrum is over the olecranon process, and the fixed arm is over the axis of the humerus, and movable arm is parallel to the axis of the radius, long axis of the radius. Now we have to instruct the subject or model to fully extend the elbow joint. Now fully extend it. (145 to 0 degree). So now we are going to measure about the elbow supination and pronation. For this, the patient position is sitting position with the arm placed over this couch and the wrist is placed outside the couch. For this, okay, this fixed fulcrum axis is placed over the styloid process. This is a fixed arm which is placed parallel to the ground, and this is a movable arm which is placed perpendicular to the ground. Now you have to instruct the patient or subject to face the palm upwards. Okay. So 90 degree, 0 to 90 degree. We are going to measure about the elbow pronation. For this, patient position or subject position is a sitting position with a forearm placed over the couch, and this wrist is placed outside the couch. So fixed arm is over the ulnar styloid process. Okay. Fixed arm is parallel to the ground and movable arm is perpendicular to the ground. Now you have to ask the patient or subject to move his palm downwards. Okay. So 0 to 90 degree. So now we are going to measure for wrist flexion. So for this position of the patient is sitting position with his forearm rests on the table. So the forearm is supinated. The fulcrum so that the wrist comes out of the table. The fulcrum is over this ulnar styloid process. Movable arm is parallel to the ground, and immovable, that is fixed arm, is parallel to the long axis of the ulna. Now ask the subject or model or any patients to bend his wrist. Okay, so we are getting 80 degree for this model. So 70 to 90 degree is a normal wrist flexion. Now we are going to measure wrist extension. For this, the patient position is sitting position with his arm rest on the table, and it's better to bring his wrist outside the table to get the full range of movement. So axis is over the styloid process, ulnar styloid process. Movable arm is parallel to the ground, and fixed arm or immovable arm is parallel to the long axis of the ulna. Now instruct the patient or model to bring his wrist upwards. So the degree is 72. The normal range of wrist extension is 70 to 80 degree. Now we are going to measure this ulnar deviation. For this, patient position is sitting with his forearm supporting on the table. So fixed axis, the axis at the mid of the wrist joint. This movable arm is parallel to the axis of the third metacarpal, and fixed arm is parallel to the long axis of the forearm. Now ask the subject or model to move his wrist away from the body or do the ulnar radiation. Okay. So the normal range for ulnar deviation is 30 to 35 degree. So now we are going to measure for radial deviation. For this, the patient position is sitting position with his forearm rest on the table, and therapist position is stand by the side of the joint where we are going to do our measurement. So the fixed axis is at the mid of the wrist joint, and movable arm is parallel to the ground or parallel to the third metacarpal, and this fixed arm is parallel to the long axis of the ulna. Now instruct the patient or model to do radial deviation. Radial deviation 20 degree. So the normal range of radial deviation is 20 degree. We are going to measure about the cervical spine lateral flexion. For the cervical spine lateral flexion, patient position is sitting. Now the fixed axis, that is fulcrum, is in the 7th cervical vertebra. So 7th cervical vertebra, and movable arm. This movable arm is just parallel to the or perpendicular to the ground, and fixed arm is along the long axis of the spinous process of the thoracic vertebrae. Now we have to instruct the model or subject to just try to touch his shoulder, touch his earlobe over the shoulder without shrugging his shoulder. Now try to touch your earlobe with the left side shoulder without shrugging the shoulder. Okay, 60 degree. Okay, come back to the position. So the normal lateral flexion range for cervical spine is 0 to 60 degree. Next, we are going to measure for cervical extension. For this, patient position is sitting position and therapist position to the side where we are going to do our measurement. For this, the goniometer fixed axis, this axis is external auditory meters. That fixed arm is perpendicular to the ground, and movable arm. Okay, movable arm is just parallel to the marker or pen which is placed in the patient's teeth. Now we will instruct the patient. Okay, teeth. Now you just try to look upward. Just move your head upward. Okay, 45 degree. Okay. So 0 to 45 degree is for cervical extension. And next, now we are going to measure for cervical spine flexion. For this, patient position is sitting position, and instructing the patient to hold the pen or pencil to place between the teeth. So, the axis for cervical spine flexion is external auditory meters. This fixed arm is perpendicular to the ground and movable arm just placed parallel to the long axis of the pen or pencil which is placed. Now, instruct the patient or model to just bend his neck. Okay. So, 0 to 45 degree is the cervical flexion. Next, we are going to measure for cervical spine rotation. For this, patient position is sitting position and that axis is to the imaginary line joining the two acromion process. Okay. This is a movable arm. Before that, we will instruct the subject or model to place the pen or pencil to hold in between the patient's teeth. So, the movable arm is placed just parallel to the pen or marker and this fixed arm is parallel to the ground. Now, instruct the patient to just do cervical rotation. Just do your rotation. So, the normal degree for the cervical rotation 0 to 80 degree. So far we have seen the goniometry measurement for neck, shoulder region, elbow and wrist region, and in the next part we are going to measure goniometry measurement for the lower limb and spine. Thank you.